Hold on this computer. Good evening, everyone, once again. Thank you for joining us, and it's nice to have you all here. Today is all about, like my husband said, is about fathers Hangout. We're talking about Andropause, and we have a professional here. We have a consultant in the person of Mr. Ike Apakama. I'm sorry if I've murdered your name.
It's all right.
Sorry, sir. I just wanted to talk to us a bit about PTN, Parenting Network. This network was established in 2017. It all started with young people because of my passion for young people. So I was working with young people a lot. Can mute ourselves. This meeting for now, right? So initially, I was working with young people, ensuring that, helping them to gain their confidence and all of that. However, there seems to be a background noise. Can you all hear it? Please, if you are, can you mute yourself, please? Yeah, I can hear some background noise. Thank you. Right, so how it all started was myself working with young people because that's my passion. And what I was working with them, and I realized that most of the time when we agree on something, they get back, they're so excited and they're ready to go ahead with it. And then they get back home. By the next time we'll speak, it will be like, oh, you know what, things have changed, mom has done this, dad has done this. And this kept occurring. It seems like that was the pattern. So I was like, it's not possible to keep treating the symptom. And thank God we have a doctor in our midst, treat the symptom and not treat the root cause of the matter. So I decided to veer into working with parents. And while working with parents, more importantly for me, because I'm a female, I work more with women, and women are more receptive of what I do. And I was working with female and it was fine. But at some point, I just felt that, I'm a Christian and God was telling me that I should work more with men. I shared this with my husband. It was a tough decision to make because I was just like, how do I look like a man in the first place? How do I get through to these people? But it's been an awesome 4 years of working with men. It's been fantastic, I can say, because I've been opened, I got open to a lot of things that I never knew that is happening as well. One of the things like today, Andropause, we're talking about, due to my research about 4 years ago, I got to know about Andropause as well. And I'm like, whoa, what is this? We always think about menopause, we think about women and not men. In fact, was it 2 weeks ago at my workplace, there was a new policy that was passed around, flexible working with women because of their menopause. I had to take that upon myself to write my principle to say, you know what, not only women go through it. I don't care what you think about me, but not only women go through this, men also go through it. So there should be a policy in place for men. They have their own andropause and all that as well. I'm still expecting him to get back to me. But I'm so glad and grateful that, I have this opportunity to work with men with the support of my husband and, other people around me. And one of the anchors that came to me in scripture as a Christian is these words I am commanding you today are to be upon your heart, and you shall teach them diligently to your children and speak of them when you sit at home and when you walk along the road, when you lie down and when you get up. Tie them as a reminder on your hands and bind them on your feet. So this tells us that, as parents as well, we are meant to teach our children all that they need to know. However, if we are not strong, if we are not healthy, what would happen at the end of the day? We won't be able to do what we are meant to do. So this is one of the reasons why it is not all about our children, it is about us as well, because when we take care of ourselves, then we will be able to we'll have the right mind, we have the right physique, we have everything that we need to take care of our children. The aim of Parenting Network is to bring stability back in the home by equipping fathers with the tools and knowledge that they need to develop themselves first, and then be able to raise effective and functional adults. And as a result, we know that, I don't need to tell you this, the rate of antisocial behaviors. I know that research says that, when there's stability in the home, definitely there is reduction in antisocial behaviors. So we do this through our online and face-to-face seminars and programs like the one we are having today. And then we pray for fathers and children once a month, and there is the one-to-one, consultation. So before I pass the baton, I would want us to have this quick conversation, discussion, or even, you can type in the comment box, andropause versus menopause. We all in the room now, how many of us have actually heard about andropause? Which of these have we heard for a long time? Andropause, menopause, which of these are we aware of? And what do you think it is? You can unmute yourself, or you can, just type in the comment box, please. Thank you. I will be checking the comment box. So we have to feel the temperature of the room so that our guest speaker knows where to exactly start from. Right. Good evening. Does anybody want to share?
Hi, Sister Cheryl. Menopause I've always heard about. Andropause is something that is new. I am here to be educated about it. So thank you for this platform. I am completely ignorant of andropause in its detail. So thank you for this opportunity.
Thank you very much. Thank you very much. Anybody else? Heard of menopause? I can see people typing in the comment box, heard of menopause, heard of menopause, heard of menopause. Good. So this is a new terrain for a lot of people, and I think it's an important thing. Menopause, someone said both really. Okay, so it's a new terrain for, let's even assume, like 60% of us. So it's important that we listen and we act on what we are going to hear from our dear consultant tonight. Yeah, that's all I want to say for now. And without much ado, thank you for everyone that's typed in the comment box. I'm just going to bring in our dear consultant who is with us tonight. I'm grateful to have you here tonight. I know that when I was looking for someone to speak about this, I didn't actually know who will be the best person that will do this justice. So I reached out to a friend, Sister Flora, because she's in that field as well. And she said, oh, I know somebody that, so I've never met Dr. Ike before, and I've never, apart from chatting on WhatsApp, this is the first time I'm actually going to see his face. So I'm so grateful. And when I was talking to him, he said, don't worry, I'm going to do it. Nothing attached, no fee attached, I'm just going to come and bless people. So I appreciate it for, giving of your time. I know you're very busy. And is also, when I asked for his biography, it was just one-liner biography, end of story. So I'm just going to read his biography the way he sent it to me. If you give me 1 minute to go over. If you have seen the flyer, you will see what I've written there. So I'm just going to read it as it is, if you bear with me 1 minute. as it prepares to come on. It's sometimes when you need these things, that's when they mess up. Right, okay, I have it up now. So Mr. Ike Apakama, he is a urologist and fellow of the Royal College of Surgeons. He is retired, he is an NHS consultant, he is a urologist in Nigeria as well, and he does that on demand. You know, I had to ask him as well, do you want me to call you doctor? Because that will be more relevant and people will engage with that more. It resonates with people when you say, oh, somebody is in the medical field, I'm coming to talk to you. And Mr. is, because he's a consultant, they use the title Mr. So we're going to be calling him Mr. instead of a doctor. So please welcome Mr. Ike as he shares of his knowledge with us tonight. Thank you so much. Over to you, sir.
Thank you. I hope you can all hear me.
Yes, we can.
Okay. My name is Ike Apakama. I'm a Nigerian trained in University of Lagos and did the early part of my postgraduate training in Nigeria, so in Enugu. But after a while, I moved to continue in the UK, and I've been in the UK now for about 31 years. I was a consultant in National Health Service in urology for 25 years. I retired about 7 months ago. So that's my biography. Now, come to the topic, andropause. Like we said before, we all know about the term menopause. That's a term known for by everybody, but andropause is more of a recent thing to many people. And what is andropause? Well, andropause derives from a Greek word, anders, and pause. That means to kind of reduction of the masculinity. Maybe I'm having a problem getting my slide to move. Not moving. Can you see that now?
Yes,
Yes, we can.
Yeah. So andropause derives from a Greek word andros, like I say, which means male, and pause, male. This same term has known by other names as well. It's also called the male climacteric or the male menopause. However, we tend not to use the word menopause for men because it's a misleading term. In females kind of at a particular time in their lifetime, it varies between people from somewhere in the late 40s to the 50s. They have the menopause when suddenly the ovary stops producing the hormones and everything goes down to very low levels and they begin to experience symptoms of menopause. However, in men, it doesn't happen in the same way. Rather, what happens is men from their mid-30s begin to decline in their level of testosterone, the male hormone, at about 1% every year, all down to in their older ages. So it's not a sudden event. So it's not like the menopause, but it can have similar effects on the person involved. Other terms for it are androclise, or androgen decline in the aging male, or late onset hypogonadism. Effectively, this is mainly presents as either a decrease in sexual satisfaction or function, and accompanied by also people feel generally less well than they felt previously. Either they feel tired, they feel kind of moody and all that. This change that comes with it. We get to that as we go along. like I said, testosterone level declines in men at a slow rate of about 1% a year. This is usually due to two factors. The first is that the testis begins to produce less hormone as people get older. And also in older men, you find that they produce more of some proteins called sex hormone binding proteins, which kind of combine with the testosterone in the body and make it no longer available to perform its function. So in such people, even though testosterone levels may be low normal or even mid-normal, but the actual active testosterone is not there, so they get the same symptoms of andropause. Obviously, we can tell that you can see some men who are in their 40s and they're scaling off quite significantly their sexual performance. On the other hand, in Nigeria, you can see men who are in their 70s and 80s looking for new wives to marry. This is because sexual function in men declines at different rates in different people. So some people, it starts very early, others will start very late. And this is the reason for that. Also, the decline in the sexual function can be affected by lifestyle. If people who spend their lot of time drinking, no exercise, just hang around getting overweight, then those people are more likely to get the changes in the sexual function earlier. Also, other illnesses like diabetes, hypothyroidism can also make this more significant as well. Now, you find that although that we use testosterone level decline as an indicator of onset of the male menopause or the andropause, it's, however, you'll see some men who have low testosterone levels and who perform function normally, and you can see men who have higher testosterone levels who perform less the lower level, probably because of the level of free testosterone available in the different individuals. Now, when this happens, what you find is that when men begin to have a decline in sexual function and all that, in our society, quite often, many societies, their partners begin to think that they're having affairs. Maybe it's got some women outside, that's why it doesn't do anything at home anymore. And this can lead to significant friction within the couple. In addition, the man who finds that sexual function is declining quite a lot, you may find that he begins to avoid situations in which he may be asked to perform sexually. And that increases the level of suspicion in the partner that maybe it's might get in somewhere else. This is why it's good for couples to be able to open and discuss openly. And if the man has a problem, to tell the wife exactly what is happening to him so she understands what's going on and try to go through it with him and to find solutions. Most situations, people will go to doctors, and in many cases, you go to a doctor say the couple goes to a doctor and say, my husband's sexual function is not very well. They just simply give you some treatment for erectile dysfunction, give you some Viagra tablets, say, go ahead, go and try it. Doesn't always work that way. So, because the other things that might be involved. For instance, the symptoms that happen to these people are low sex drive, erectile dysfunction, they kind of always tired, lack of energy. And in some men, either it's a consequence of them having depression primarily, or the fact that they can no longer perform effectively makes them become depressed. So depression becomes significant, either as a cause or as a consequence of this. In such people, there's not interest in many things, and things they used to do before, they don't want to do it anymore. They're home with their wives, but they just fall asleep. So they get more sleepy, and they get very irritable because they're not feeling well in themselves. They feel that everything is not right. In the extreme situations where the testosterone levels are very low, some of the men might they become to lose their muscle mass. They look less masculine, less muscle, and they get more fats in their body. And in some very rare circumstances, they get what they call hot flashes, which is common in menopause, where the person suddenly feels very hot, even when the room is very cold, and starts sweating intermittently. That's the hot flashes. It can happen in men, but not very commonly. Now, when these things happen, in medicine, we always say what we call differential diagnosis, which means what else could it be? If it's not just the decline in sexual function, what else could be happening to the man? One of the things is thyroid illnesses. If you have a low thyroid function called hypothyroidism, then the person gets slow in everything they do, and that will also show in their sexual performance. But the primary problem is not with the sex hormones, rather with thyroid hormones. And in such a case, if the doctor makes a good diagnosis and puts the patient on thyroxine, then that will.
None of that matters. It's just about watching the best of the best.
What was that? Hello? Like I was saying, so other things that can have similar things are also people who are chronic alcoholics, people who have a lot of stress, anxiety, and men who are taking particular medications like steroid treatment, spironolactone, which is used for heart failure, digoxin, heart failure, or people who take drugs like cocaine and things like that, and also men who are on antidepressants. These all have the effect of affecting their sexual function and their general well-being. So we will say that to diagnose andropause, the minimum requirement is to have a low libido, erectile dysfunction, and low testosterone level. These are the typical thing you find in men who have got the true andropause. So how do we try to make a diagnosis? As doctors, when someone comes to us with this kind of complaint, the thing we look at is try and see what else it could be. So we check their testosterone levels, and where possible, also check their free testosterone levels, check the blood sugar for diabetes, do the cholesterol levels, and ask them about their drug history. What medication do they take? And will they take any unprescribed medications for whatever reasons? Also, we can do the level of some sex stimulating hormones, which are called LH and FSH, which are the primary hormones that help to stimulate the testicle to produce testosterone. Because in some men, what happens, they develop a testicular failure, and these hormone levels will be quite high to show that they have got testicular failure. Having said all this, we also have to bear in mind that as people get older, the functions get less. So an older man will be less able to perform sexually, and that's not an illness, that's a consequence of his age. And you have to bear in mind that when you seek for treatment, you can only get so much improvement. You cannot expect an 80-year-old man to be like a 30-year-old man. It's not possible. So you can only make to be like the best an 80-year-old man could be or 70-year-old man could be. If you go back when you were young, you think for the men, you think that when you're in your late teens and early 20s, you go sexual intercourse so many times a day, every day of the week. By the time you're mid-30s, you couldn't keep that up. And by the time you're mid-40s, it's a lot less. And by the time you're in your 60s, it comes down to only on birthdays and special occasions. So this is the natural occurrence. If you expect much more than what's supposed to be, then that is not being realistic as well. So what are the effects of relationships? You have an irritable partner, like I mentioned before, sexual infidelity. And then the woman begins to say, is it my fault? Have I become unattractive to him? Am I being too demanding? Have I got fat? And all that. Sometimes they blame themselves when there's actually nothing wrong. The person, like I say, could be depressed, or if not depressed, the problem can make the person feel depressed. So that becomes part of it. And you find that some men who feel under pressure to have a sexual performance can deliberately pick up quarrel with their wives to avoid getting in that situation where they have to perform as a way of defending themselves. So if you see a husband who is picking up too many quarrels, ask him to be honest, are you having difficulties down there, and see how you can approach it. This problem is worse if you start at an early age, because if it's a 70-year-old man, it's easy to accept. In a 40-year-old man, it's more difficult to accept. This is the truth, but it can happen. It begins to happen at the age in 40s, 50s. It's just a matter of chance. So how do we address this? The first thing you can try are the non-medical interventions, which is basically lifestyle changes. Healthy eating, eat more fruits and vegetables, less red meat and less fattening foods, cut back on sugars, if possible, eliminate them completely. Check your alcohol intake. If the alcohol intake is very great, then you need to cut down the alcohol intake because the lower alcohol levels might improve the person's performance. For those who smoke, stopping smoking might help because smoking can affect the blood vessels, and the blood vessels get narrower. That affects blood flow to the genital organs, and that affects sexual performance as well. So cutting back on smoking can lead to some improvement over time. Some people try other things like they say yoga and breathing exercises. Also, generally, getting exercises can help because when you have an exercise, the body releases some chemicals called endorphins, and these chemicals make you feel better in everything you do. So just having exercise, taking a walk brisk walk for 30 minutes, 3 times a week, can lead to some improvement. Could lead to some improvement. Counseling is important in that it helps both partners to understand where each person is coming from, and you seek for help together. So you begin to accept whatever outcome we get together, because counseling cannot be done separately. It will not going to work. So it usually require couple counseling. And you can also think of new goals, things to do besides thinking about only sex. You can, like with older people, go on holidays, take long walks, do other things together. For those who are Christians, maybe get more involved in your church activities. You have less time to think about other things when you get home. Just all these things, changing the way you live your life can make a difference. Even if not making things better, make it easier to accept the situation in which you find yourself. What is the treatment? Well, like I said, andropause is part of the aging process. Doesn't always have to be treated. In some situations, if both partners are happy to understand that this is part of the aging process and they're willing to accept it, they can just accept it and live with the situation and they're happy with it. Because relationship is not only about sex, the other part of relations, one part might go down, and the other part might pick up. So in some situations where the partners accept the situation, they can just learn to live with it and they're happy with it, that's fine. However, some men who have this syndrome of andropause, like they have other medical conditions, and if those are treated, then the symptoms get better. So we treat thyroid diseases, treat liver disease, heart disease, and the functions might get better. Okay. Now, one thing you have to bear in mind is that people always worry about the men can't get erection anymore. You have to ask yourself, why can one man get erection and another man cannot get erection? Truth is that some men not being able to get erections, they kind of way of protecting themselves from dying. Because if you think about it, when you hear about men who have died having sex in hotels, it's usually not with their wives or partners, it's always with someone new, someone outside the house. So because they try so hard to impress the person and they kill themselves in the process. So the thing is, when people are not able to have sex so many times a year or so many times a week, sometimes accepting it can be safer for the person if they have got other conditions leading them to that situation. You don't always have to treat. Now, where you want to treat, the main treatment is to give testosterone replacement. However, testosterone is also involved in the development of prostate cancer. So first thing you have to do is to check the person's risk of prostate cancer. Look at the person's family history and everything else around prostate cancer. Do a blood test, check their PSA level. If this is any indication that they could have prostate cancer, then you should not have this treatment. Where the person is very keen to have treatment and you were worried about this, you can also go as far as doing ultrasound scan and MRI scans to assess the prostate for risk of cancer. Now, men who are in this same age range also have problem with their prostate diseases. They're having to go and pee so often, very frequently, sometimes having difficulty peeing. And going on this medication can make those symptoms worse. So men who already have problem with their prostates should avoid the testosterone treatment. Now, how do we give the treatment for testosterone levels? There are different options. You could give them some creams or gels which they rub on the skin. You can give them tablets, you can give injections. We go through them individually with the skin patches, which is like a bit of plaster, which is impregnated with the hormone underneath it. They stick it to the skin somewhere that not exposed, like in the back, on the belly, inside upper arm, or their thighs. And then the hormone is released slowly into the body system and absorbed, and hopefully as testosterone level improves and other measures are included, then the symptoms get better. An alternative to the patch is to have a gel, which is like a liquid you apply. So they apply it again on the upper arms, on the thighs, and on the abdomen. And the gel contains the hormone, which is absorbed through the skin at a slow pace, hoping to improve the testosterone levels. Where these simpler methods do not work, then we can go on to the next step, which is taking some capsules, normally taken twice a day after meals, which contains testosterone. However, this is not for men with liver disease or who have poor liver function or heart and kidney disease. So before you go on the treatment, you have to make sure you're reasonably fit to take the medication. The final thing is where all the other methods have not worked, they go to an injection. This injection is given every 2 to 4 weeks, and that's indefinitely. So it means you have injections like every other week or every month for as long as you need relief from the symptoms of andropause. And I think that in a nutshell is all I've got to say about andropause.
Thank you very much, sir.
Yeah.
We already have some questions here. Please,
Yeah.
if you have questions, you can either unmute yourself or just drop it in the comment box. So I'll try and read some of these questions. Someone said, my first time of hearing andropause, didn't know men have their own version. Is this what they mean by midlife crisis?
Well, midlife crisis is a combination of things. The andropause could contribute to it. What happens is sometimes men are trying to show that they're still as good as they used to be. So some men, in an attempt to show that they're still virile enough, they begin to have affairs outside. Some people find other pursuits, buy fast cars, do different things. So they are kind of linked because they happen at about the same age. But you cannot say they're completely causative, but they're related.
Okay. All right. Thank you, sir. Thank you very much for your support. Somebody said. What else? I think I saw a question. Is this more common in certain races? Never knew men can get hot flushes as well. If you want to talk to us a bit about that, and is it common in certain races?
No, it's not race specific. Anybody in any race can have it. What we know from previous tests in men is that you find that Africans tend to have the higher testosterone levels than, for instance, Asians, Indians, and Japanese. But it doesn't matter. They all still have ultimately everybody goes to the same andropause. Now the hot flushes is just happens. What causes the females is in females the estrogen levels drops at menopause from a normal level to a very low level, and that change is what triggers out the hot flashes. In men, the level does not drop the same way it drops in females, except people who have had some reason for it. For instance, people who are treatment for prostate cancer, who are taking hormones to block the testes, get hot flushes. But some people who have a decline in the testosterone level, if it becomes, by the time it becomes very severe, they could experience some hot flashes. But they're not as bad as it happens in females. It tends to happen when the hormone levels drop rapidly, which is not the case.
Thank you very much, sir. Does it come with mood swings?
Yeah. During andropause, because of this changing hormone levels. If you remember, if you go back to when women are having their periods and when they are young, some women when they are having their periods, they get very bad, get very moody because of hormonal swings. Similarly, when the men begin to have this decline in testosterone level, it can affect their moods, but it varies between individuals. You can see a man who has got low testosterone level, it's perfectly normal, everything is fine, no mood swing, nothing. You can see another man who has a slight decline and he has mood swings. So it varies between individuals, but it happens as part of the process. This is why I say that sometimes people will find that when people are having the mood changes, sometimes is it like when you are depressed and that makes you feel worse, or is it that because of the andropause that makes you feel depressed because you're not doing very well? So this question of the egg and the chicken, which one comes first? Nobody can say for certain, but there's a relationship.
Thank you, sir. Good talk. Oh, let's see, it's gone. Let me see. Good talk. What is your take as to where to take liquid last before going to bed to avoid visiting bathroom through the night?
That's a personal thing because you have to, it depends on you. If you don't mind, if you find that you get up at night, have a wee, and you go back to sleep, it doesn't bother you. So you can drink whenever you want to drink. If you're the kind of person that wakes up at night to pee and then cannot go back to sleep for hours, then the advice is to be for you to have your last drink about 6 hours before the time you go to bed. 4 to 6 hours before. It's difficult, but what you do is if you drink a lot of drinking during the daytime, so by the time you go to bed, you don't know you're peeing, so you don't take a drink before going to bed. And also what you drink as well affects it because if you decide to drink caffeinated drinks in the evening, tea, coffee, Coca-Cola, things like that, or alcohol, which also has effect on making you pee in the evening, then you get up at night. So it's a question of what the individual wants. But if you don't want to get up at night, you have your last drink before 6 p.m., I'll say.
Okay. Pardon me, but men are not great communicators sometimes. How can partners or wives provide support, as you can only help with what you are aware of? What are the key things to look out for?
That's a difficult one because, like you said, a lot of men don't share their problems because you know what is in society. Say, behave like a man. So you're not supposed, man is not supposed to complain. Say, behave like a man. Can you man up? So men are taught to hide their feelings, don't express them because you might be less of a man than the other people around you. So you find that it's difficult for men to come out and complain about what's wrong with them. However, if the woman notices that husband is, for instance, a bit moody and all that, or not doing very well in the bed and all that, they should sit down and ask them what's going on, and they try to have as much discussion as you can. But there's no single answer to it. It depends on the relationship within the couple for you to work that out.
Thank you, sir. Can I just say here, we hear this all the time, and whatever we hear all the time, it's important to make changes to it. These are things that are dear to our heart as women, and relationship is about, just, making some compromises and changing, and, if women keep saying that, men don't talk, men don't, and I personally know that over the years, there's been so many changes as we expose ourselves to information, as we expose ourselves to so many things, survey, questionnaires. I've seen personally that men are changing. Please, can you mute yourself? Thank you. However, it's still something that is very dear to our heart. And part of some people's love language is, just spending that time, communicate. Every woman wants someone to, their husband to communicate with them. And this is coming up again and again. It's coming up, it comes up all the time when we have meetings. So I'm just, I'm like a mediator, really. And all I'm saying to men is, we know you're trying, but we want you to try harder. It's like what we say to our kids as well. I'm not a magician. I don't know what's in your mind. We are adults. And part of being intimate is to be able to communicate, to be able to share those things that seems like, unshareable. That's why we have these partners, because a problem shared is half solved, they say. So I'm just employing our dear fathers, our dear men, that this is something that is dear to us. And either we like it or not, it does strengthen relationship. Forget Andropause. It does strengthen relationship generally. So I'm just employing us. I don't want it to just slide away like that. That even as we round up, please make this as part of your new month resolution. As we round up the new month, that this month, make this a new month resolution that, you know what, I want to communicate better. I want to reach out to my wife better. Thank you very much. Yeah. Yes, sir, you can.
I think that also we have to look at the way we raise our kids, because in a typical Nigerian way, a man is supposed to get on with it. So the student complain. So I think we have to understand that men have a right to complain when they're young. Raise your children a bit differently, to be a bit more expressive about their feelings when they're young, so they can carry it into adulthood. You can't learn it, because it's difficult. Learn an old dog new tricks is difficult. So if they learn it from when they're young, then the lesson carries on further down the line. So maybe, like we say, women do more communication aside, because men are not taught to express how they feel. So the women should spend more time talking to their sons about feelings and all that, making them understand there's nothing wrong with discussing your feelings.
Yeah, thank you, sir. I think that's a very good point as well. I had a big sister. She told me a couple of months ago, she said, I think herself and her husband had a sort of argument. And when everything died down, she went to our son and said, you know what, argument is part of our daily life, but it's just the way we come back and resolve conflict. There's nothing bad in conflict. It is how we manage it. So when you have a wife, you don't expect that your wife will always come to terms with your own belief or your opinion. However, you still need to respect your wife's opinion, and you need to, at some point, manage your conflict and resolve it. So yeah, just to buttress what you said, that it's important that, some of these things that, of course, women have their own issues as well and weaknesses. However, of course, raising our kids, raising our children, raising our sons, it's important for us to let them know that, this is not the right way to do things sometimes, or if you are in these shoes, I would expect that this is how you treat your wife, or this is what you do. Thank you. The next question, why do you think men are not generally educated about this in the same way women are pushed to know about menopause and the changes in our bodies?
The simple answer is that, like I said before, menopause comes at a particular time in life, at a particular age. It happens and it happens. So it happens to every woman at some point. But andropause is not something that happens at a particular time, just a gradual decline of sexual function and well-being. So it's not the same. So it's difficult to understand. So it's not discussed as openly as menopause. But I think that what people should understand that as you get older, things change, and people should begin to talk about the changes that they go through and what can be altered to make you feel a bit better.
Right. Thank you, sir. Keep the questions coming. The questions are coming. Does genetics affect who is predisposed to having andropause?
It's cold. But genetics is a complex thing, because genetics, when you have genetics, you have genes from both sides of the family. So even if your father didn't have it, maybe someone your mother's side may have had it. So it's difficult to say, but generally, matters affecting sexual performance, prostate diseases, breast diseases, they tend to run in families. So there's a familiar aspect to it. So if it happens to people in your family, it will happen to you.
Okay, thank you, sir. If you have a supplementary question, you can mute and ask your question, or if you think that it's not well answered to your satisfaction, maybe sometimes when you unmute and ask the question, it might be better. What sort of advice should we be giving our young men about andropause? Is this covered in school curriculum? I know girls come across menopause awareness.
It is not, like I say, it's not the same as the menopause because it's something that happens gradually. It happens as we get older. And the young men don't think they will get old at that point. So I don't think they're going to be listening to you. I'm not sure it's a good thing. I think it probably should be introduced at time of marriage counseling, when people are beginning to pair up as partners and that kind of life, when you begin to belong to clubs and when you're in your working life, that's at that point where I think it should be introduced. But that's my opinion. That's my opinion.
I think these are the questions I have here at the moment. I've not missed out any question. Any other questions from the audience? I'll just give 1 minute. If there is nobody raising their hand. Oh, thank you very much, sir, for the wonderful session. I do hope that we have gleaned, we have learned, we have been exposed to, how we can be aware. We are exposed. We have the information. As in the chat, do emotional. Okay, what medication or vitamins can men take to assist or delay it?
There's no particular vitamin you can take, but generally, as you get older, obviously work into from you can see when they show different medication for over 50 men and all that, the world man, all those different vitamins. Any of them over the counter will do. Just make sure you have normal vitamin levels, and those specific vitamins that can prevent it.
Okay.
But so I'll say eating healthy and exercise is the most important part.
Okay. So well man, like we have well woman, we have well man.
Yeah, well man, yeah.
Yes. So the vitamins, any of those vitamins.
Yeah.
Okay. Thank you, sir. I guess can we mute ourselves, please? Can you mute yourself? Thank you. I guess having things like Viagra and sexual enhancing drugs over the counter is a way out of andropause. Is this right?
No, but it's a way to help erectile dysfunction when it works. So if a man is having difficulties performing sexually, as long as he understands the risk factors you have considered before taking Viagra, again, those things over the counter is worth a trial. If it works, then that makes things a lot better. But it's not always just about taking Viagra, about other things. Like I said, if the person has other illnesses like diabetes, hypothyroidism, Viagra may not work necessarily.
Thank you, sir. Do emotional and financial stress play any role in the onset of andropause?
I don't know if it will cause the onset, but it will generally affect it because if you're under stress, then your body produces stress hormones and things don't work as well as they used to work. And obviously, if a man is always thinking about where the next meal is coming from, family, how do I pay my rent? They have less time to think about other things. So the performance in sexual matters might decline significantly. And in such people, if those stress are taken away from them, then things might get better. So even if that's not the cause, it's a confounding factor, makes it worse.
Okay. Okay, I think that's all I have for now. If you still have any question, we have a couple of minutes, and I know we'll be able to squeeze it in. Just to say thank you to Mr. Ike for joining us tonight, and I'm sure that we have gleaned one or two things, and we are taking some information back to our homes, and that will help our family life, because it's all about, family life. It's all about our fathers being the pivotal, the center of the home, and, stretching their hands to the children, to the wives, and to everybody around them. So we want you to be in good health. We want you to be informed so that you can make those decisions that you need to make on time, get vitamins, everything that we have been told today. And it's also good that, our women know that men go through this as well. And sometimes, like when we go through our own thing, sometimes some people get edgy, some people, people behave differently. It's also important to know that they go through these things so that we can support them whilst they support us during our own time as well. For example, when I'm on my period, I always tell my daughter, even at some point, she knows that, oh, mommy will be a bit edgy. So she'll say, oh, mom, are you on? Why are you behaving like this? So it's always important to know these things so that we can support each other to live a balanced life. I think another question. Oh, huge thank you to our resource person. Thank you so much. This has been very informative. Thank you so much, everyone. Before we go, I just wanted to I just want to share some of our programs coming up. Like I said, this is more parenting, is more dealing with young people, and our special fathers. They are very special to us. So our upcoming programs in January, we will be talking about dealing with trauma. Like we're saying that men don't really, they're not very expressive, sorry to say, but some of them are not, majority of them are not. So dealing with trauma, they have experienced traumatic, things in their lives and probably not been able to tell anybody, and is affecting them, the way they behave, the way they come across, and all of that. So we'll be looking at dealing with trauma in January. In February, March, we're hoping that we'll have a weekend away. Yay. I don't think this is not something that is very common, but I'm hoping that we will be able to get the information out very soon. And I'm hoping that we'll have a nice time. Men, not women. We don't want, I'm sorry. Just purely for men. Okay, you can't slide into our meeting like you did tonight. But thank you for joining us. It's been wonderful. You can join our WhatsApp group. If you want to join our WhatsApp group, you can just message me. My phone number is on the flyer, I think. And we have monthly prayer meetings as well. Praying for fathers and their children. We are in need of volunteers as well. Volunteers in many ways. We have partnered with some organizations. We know that we need male role models. It's a need. It is a need in this time and age. And there are some organizations that run programs for young people that we have partnered with that are looking for male role models. Getting involved with Met Police. There is a scheme that is out right now in in the United Kingdom, in London, I know of, which is about having more Black people visible within the police sector, within the Met. And it's for us to expose who we are and talk to the policemen about who we are. Why do they stop our children? Why is there that discrimination and stuff? But we need to be in there to be able to influence what they do. So if you are interested in, you are not going to, they're not recruiting you as a policeman, but you are representing Black people. I am part of them. I'm into criminal justice and policing, so I'm representing them as well. So if you want to get involved or you want to know more about this, please get in touch with me, or you can just send a message. I think as we round up, thank you for the organization and the doctor, very insightful. Thank you, sir. Unfortunately, my wife is not available for this meeting. It will be nice if we can have this meeting again. Anyways, thank you and God bless. Thank you very much for the kind words and the comments. Lastly, I would post the feedback form, which we'll always do this so that we will be able to serve you appropriately. So I'm just going to post the feedback form, if you bear with me, so that, you know, whatever you want us to, whatever topic you want us to treat, to bring on, please put it in the feedback form. I can see Juliet's hand on. Do you want to unmute yourself and speak, please, while I post this on there? Juliet, unmute yourself, please.
Hi, Counselor. It's absolutely wonderful to see you, joining you as usual. And
Thank you for joining.
just to say that we need men to look after themselves as well. Self-care is absolutely important because, you know, many a times when men we see, you know, like they just know how to work, come in, go home, and especially our Black community. So I want to appreciate you. And of course, Dr. Ike Apakamas, thank you so much for bringing an insight of all these hormonal changes, even for men. That has been absolutely wonderful. So I'm blessed to be here. And
Thank
so
you.
much for the work that you're also doing. And even here in UK, we need our men to talk about their issues more because, you know, cost of living is going up right now in United Kingdom. We've got a lot of anxiety. Men get a lot of anxiety, and sometimes they want to keep it to themselves. So we want to encourage men who have got families or a couple, and also when, you know, children pick from the anxiety as well in a home. So let's continue this discussion. I'm absolutely just happy that we are discussing these issues, Councillor Flaka. And of course, if you're in in Kingston as well, if you live around there, let's keep supporting our councillor there as well. We also want more of you to get into issues of, I mean, I really wear the heart of politics. The London Regional Diversity Champion for the whole of London. So I'm here because I also love to champion, because we need to be at the forefront of our agenda. Men's, you know, our African diseases need to really, really be looked into as well. So let's champion.
Thank you so much.
So I'll leave you to that, and thank you so much.
Thank you so much, Juliet. Thank you. Thank you for joining. I have, as we round up, I have just posted the link. We'd love to hear from you, feedback. Please fill it, and I will just say thank you for joining us. Thank you for spending your evening with us. If there's anything you would like, any question that is not yet answered, you can send it to me, or any question that you have, then I'll pass it on to Mr. Ike. I'm so conscious of calling you by your appropriate name, Mr. Ike. And thank you so much, everyone. I think, except if you have anything to say, I will want to call it a day tonight until we, anybody? Ake, do you have something to say? Okay, no. So till we meet again next time, have a lovely evening. Enjoy the rest of your evening, and Enjoy a nice week. Have a nice week. Thank you so much for joining.
Good night.
Thank you, sir.
Bye.
Thank you very much, sir.
Thank you. Bye.
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 Bye.